Well, thank you for coming here tonight. My name is Marilyn O'Connell. I'm pleased to be a member of the High Flyers, and I will just give you the good news right up front. We're not going to sing or dance. Aww. But we've got some great stuff for you. First, I'd like to introduce the team. We have Sarah Gallegas, who is the navigator of our team, and she's known for keeping us on track no matter what with her cool style. We have Debbie Moore, who's our morale officer, no surprise there, and she keeps our spirits high. We have Carol Reebok, who's our chief facilitator officer because she keeps the flow of the conversation on track and our ideas going. We have Wendy Lynch, who's our chief inquisitive officer because there's always one more question to ask, one more fact to find, one more thought to pursue. And we have Greg Baer, who is our pilot of the High Flyers, because he inspired us to get this right, and he can fly a plane, actually. And I ran the catering department. Okay.
Well, our project is Live Healthy Napa County Symposium, and the way that got started is an initiative was already happening in Napa County with the Public Health Department and the Nonprofit Coalition. And assessments have been done in the past, usually every 3 years, but this assessment was a major departure than those in the past. It usually focused on much more of the medical model, what was happening in the hospitals, how people were accessing health care. But this initiative was getting much broader and realized that health is not just about medicine, and it's much more about how we live, which is Live Healthy Napa County. And it makes us really think about the food that we eat, the exercise that we get. Do we have parks? Are we living in a community that's safe? And so this assessment not only broadened what they were asking in terms of what happens in Napa County Health, but also who got included in the assessment. So there were focus groups and there were surveys. High Flyers came into the project after most of the assessment had been done and began to think about how are we going to spread these findings throughout the community. And our role was a couple of things. One is the idea was to broaden the base of people who were currently involved, which was about 60, a core team and a steering committee. And what the whole initiative was basically saying is, we know that the community can solve their problems, that as a community, we need to come together and work together to look at the findings and then come to those solutions. And so we wanted to make sure that all the stakeholders and all the community leaders would know about the project and know about the findings. Dr. Karen Smith and Kara May, who's been brought up before at Public Health, were very instrumental in working with us as we began to achieve a couple of objectives. The first, again, was to broaden the list of who would come to the symposium and would hear the findings and make it engaging and entertaining, and most of all, make sure that people got excited to take action.
Because the assessment and symposium were really about engaging the community and educating community leaders on the state of the Napa County Health, we thought that we would also educate you all tonight by offering you a couple of things. You each should get a blue form that actually has a summary of the key findings, and you can take this home and read it at your leisure, possibly share it with friends and family. The other piece of paper, however, is a pop quiz, because we would like to test your knowledge of the health of Napa County. So if you can just start the slideshow, Kyle, and then we're also going to just give you a minute here to read the quiz. I will tell you that the slideshow that you'll be viewing is some images from the symposium itself, and we will be giving you, revealing the answers to the quiz later in the program.
right, so what was our role? What were we tasked with? When we met with Dr. Karen Smith and Kara May back in December, we were tasked with putting on the symposium. So not only planning, designing, the outreach marketing, but also facilitating the event. The goal was to present the key findings of the assessment to stakeholders, experts, policymakers, community leaders, and elected officials, as well as to celebrate the success of Live Healthy Napa County to this point and have attendees leave excited about what they learned. We were provided with a list of 60 steering committee members. In the end, we had sent invitations to over 200 community stakeholders, of which nearly 100 attended the event. We successfully broadened the base of key stakeholders beyond the steering committee members, brought them together to expose them to the state of the Napa County's health, and by creating this awareness, we planted the seeds, essentially, by solving our health issues through policy decision-making. Of the 67 evaluations completed, we received very positive feedback, including commitments to personal actions. The high rankings included the video and data presented. Others mentioned there just wasn't enough time. Overall, everyone found the symposium to be very informative and well done. And as an update, the community health assessment actually was just released last week and can be found for your reading pleasure at countyofnapa.org. Attendees, and actually Kara May, challenged the group there that morning. There were 75 likes that morning. We're now over 150. And I would encourage all of you to like their Facebook page as well. Thank you.
So as the morale booster of our team, let me tell you how we got here. Well, we are the design of many other great leaders who have dedicated themselves to seeking out and challenging the best in others. Thank you, Leadership Napa Valley. We started out as 6 puzzle pieces that came together to become Leadership Napa Valley Class 26 High Flyers. High Flyers. We persevered with our unique and individual talents and with very few resources. You know about that, Kara May. And we challenged the process with dignity and respect for each other and for those that we would serve. We became a team, and what we learned was that teamwork is dream work, and together everybody achieves more.
So it would never be complete without thanking the many people who helped us in our Practicum project this year. Dr. Karen Smith and Kara May McGarry. And Kara May is a candidate for next year's leadership team. So, hey, well, gotta plug you while I can. Jennifer Hann and Heidi Mensch, also from the Public Health Department. Suzanne Schiff, Brad Wagon-Connect, St. Helena Hospital, the Napa Valley Vintners, Town of Yountville, Napa TV Channel 28, Leadership Napa Valley, CCASA, and Cafe Kenyon were all part of making the symposium a huge success. After the symposium was finished, we received this testimonial from Kara May and seconded by Dr. Karen Smith. Congratulations on pulling off an extremely fabulous and successful event. The Leadership Napa Valley High Flyers really added a dimension of style with substance that the public health would not have been able to achieve without your resources and your creativity. And well done. Well done to our group.
So as you heard from Sarah, that the feedback that we got, one of the things was that they really enjoyed the video. So we put together a video and thinking about how we wanted the symposium to go. We wanted something more than just the statistics revealed and people talking. We wanted to add another component, a visual dynamic and something that people didn't expect. And so we wanted to talk about the health of Napa County and also relate that to other communities throughout the country, because we know that health concerns exist in all communities. And so what we did is we searched for different ideas, but we came down to using content from the HBO documentary, The Weight of the Nation, and then we inserted our own slides that are relevant to Napa County. So this was a collaborative effort of our team, James of Napa TV, and many hours were spent putting this together. So it's something that's going to be continued to be used by staff at Health and Human Services. So this is going to live beyond our Practicum project. Again, it was highly praised after the symposium, and something that we wanted to share with you because we thought that it really put forward a message for you guys to all take away. And this is where you will find the answers to your quiz questions. Thank you, and I hope you enjoy the video.
This shows you as heavy as I was.
How light are you?
About 280.
18+% of our children right now are obese.
If you go with the flow in America today, you will end up overweight or obese, as 2/3 of Americans do.
I don't want to be fat for the rest of my life. I've got diabetes,
Sleep apnea.
high blood pressure.
I get dizzy when I get up.
Everything's hurting now.
If we don't now take this as a really serious, urgent national priority, we are, all of us individually and as a nation, going to pay a really serious price.
The weight of the nation is not healthy. All of us have to be part of the solution to reduce obesity in this country. Otherwise, we're going to be faced with steadily increasing healthcare costs and the lives that are lost from cancer, heart disease, diabetes, and other problems.
We were using data to track the changes in obesity and used maps of the states that showed the changes over time. As we go forward, the country begins to transform from having no state with a prevalence of over 15% to this very dramatic increase, such that 12 states now have a prevalence of greater than 30%. The issue of obesity is not solely an issue of personal responsibility. It's an issue of the way we live. It's the way our communities are designed. It's the policies that promote those designs. And one of the challenges that government has is to play a role in fostering the development of those healthy choices.
Interesting things about this. The red spots in this particular map are where the highest rates of poverty are. You certainly see a correlation between poverty levels and high health risk areas in the city.
In this area, almost 1 out of every 3 children is considered to be overweight or obese.
We need to do what it takes to stop the epidemic and get people healthier. We've got this great opportunity to try and create conditions where healthy choices are easy choices.
We know that to be healthier, we need to eat better and we need to exercise more. And then how you make that part of a city is really the challenge.
The way our communities are designed has helped foster inactivity, which has contributed to obesity as well as multiple other health problems. And the solutions to this problem are changing communities to promote increased physical activity. I think obesity is perhaps the biggest threat to the health of this country, to the health, welfare, and future of this country, because of the very substantial impact that it has on not just health, but productivity of our workforce. So we have to solve this problem not only at the federal and national level, but at the individual level, at the community level, and within worksite.
Employers are profit maximizers, and they've recognized that on average, obesity is costing about $70 billion per year to employers. And so what they're saying is if I can implement low-cost programs and these programs are effective, then that could save me significant money. So what we're seeing is a wave of programs across the country aimed at getting employees to engage in healthy behaviors, be them related to obesity or smoking or other factors.
So what is happening here is that we have data that can document that not everybody have the same resources to fight diseases. And at the end, the epidemics are reduced to the pockets of poverty.
Where you live matters, and it matters a lot. Another way of putting this is, does your zip code matter more than your genetic code?
We know that we have these problems. Unsafe streets, no parks, no time for your kids, fast food outlets. And you have kids that are very obese. There are many communities in this nation that do not have the resources to fight this epidemic. So we are talking about a disaster for communities in this country. What diabetes and obesity is doing to this nation is crippling the families and the individuals. I need this country to talk about low-income families so we can really design realistic strategies.
In the low-income neighborhood, there's a different food environment. Not only do people make less money, they're surrounded by lower quality food, it's difficult to get fresh vegetables, and they're more stressed. And so it brings up this question of what degree of free will do people really have when they're in a certain controlled environment? And until we can understand that there are large social and economic forces that predict obesity, we're never going to solve the epidemic.
We know that in this area, almost 1 out of every 3 children is considered to be overweight or obese. And this is an area, as you were saying, with poverty, the average household income is less than $25,000 for a family of 4.
There's a societal, not just responsibility, but I think investment issue here, because everyone benefits from everyone else being healthy.
You know, there is a power in knowing your neighbor and becoming a community. And in order to participate, to be part of the solution of this obesity epidemic, you are going to meet those neighbors, you are going to come to learn something, and we are going to generate ideas. And those ideas are going to become strategies.
We need more people to participate in decisions that are being made about investing in open space and parks, investing in grocery stores, farmers markets, and education of our kids around healthy eating and healthy diets. I'm one of those people who believes we can reverse this trend. And we do that not as individuals, we do that together with other people in communities.
As long as we continue to focus on this problem as a problem of personal responsibility, we're not going to succeed in making the changes in the environment that are going to reverse this epidemic.
We're just walking for exercise. You want to join us? Come on.
We have to address the nutritional issues in this country, and we have to address the barriers to physical activity.
The weight of the nation is very light if it's supported by all of our hands. And it's extremely heavy. It's an incredible burden if we don't do something about it.